Hi everyone, and welcome to another episode of Tiny Matters with Dr. K. Now, if you have a toddler, I want you to think back to the last week. Did your child fall off the couch, bump into the wall, trip over absolutely nothing, climb something they definitely should not have climbed, or somehow injure themselves while standing perfectly still? If they did, congratulations. Your toddler is developing exactly as expected. Toddlers are wonderful little contradictions. They have the confidence and strength of Olympic athletes with the coordination of baby giraffes. They are curious, fearless, adventurous, often unaware of their own limitations, which makes for frequent accidents, a lot of them. And while most bumps and injuries are harmless, some need closer attention. Today we're going to take a look at some injuries that need us to take a closer look. So today we're talking about the injuries that make parents panic and what you actually need to know. Before we talk about specific injuries, let's talk about why it is that our toddlers seem to want to keep us stressed. Toddlers are designed to explore. They're learning balance, coordination, risk assessment, and depth perception. The problem is, their curiosity develops faster than their judgment. They can climb before they understand falling. They can jump before they understand landing, and run before they understand stopping. The result? A lot of accidental injuries, most of which are entirely normal. Injury number 1, the head bump. Now this is the injury that causes the most panic. Your toddler falls. There is a loud thud, then silence, then the screaming starts. At which point most parents ask, does my child need a scan? The good news is most childhood head injuries are minor. The things we like are when they cry immediately, behave normally afterwards, eat and drink normally, and continue to play afterwards. The things we don't like are repeated vomiting, an increase in drowsiness, confusion, seizures, a severe headache, loss of consciousness, or any abnormal behavior. A big bump on the forehead often looks very dramatic, but is usually not serious. Injury number 2, the fall from the bed. Every parent thinks they're the only one, but they're not. It usually happens in seconds. You turn away, you hear a thump, and your child is lying face down on the floor. Most low-height falls are not dangerous. The same head injury principles apply as before. The child's behavior matters more than the noise of the fall. Injury number 3, cuts and stitches. The amount of blood from a small cut on the face can be phenomenal. The face is a highly vascular structure, which means there are loads and loads of tiny little blood vessels, which means a small nick can seem to bleed forever. Parents often assume that the injury is worse than it is. Questions to ask include, is the bleeding stopping? Are the edges gaping? Is it deep? Or is it on the face? Some cuts need stitches, many don't. When in doubt, contact your healthcare provider. Injury number 4, burns. Now this is one of the most preventable injuries that we see very commonly in little children. Common culprits include tea, coffee, bath water, noodles, and hair appliances. The most important first aid is cool running water, not ice, not toothpaste, not butter, not ointments. Cool running water for approximately 20 minutes will help to soothe the wound. Injury number 5, limping after a fall. This terrifies parents, as some children may completely refuse to walk after sustaining an injury, particularly to the limb. Things we need to assess include swelling, tenderness, a reduced range of movement, and a refusal to bear weight on that limb. Any child that refuses to bear weight should be assessed. Injury number 6, chipped teeth. Now this is a very common injury, particularly in toddlers who are learning to walk. Questions to ask include, is it a baby tooth? Is it loose? Is there bleeding? Or is there pain? Most of these need assessment. Injury number 7, fingers indoors. A classic toddler injury. Watch out for swelling, deformity, persistent pain, and nail bed injuries. These injuries can commonly involve fractures. Injury number 8, the mystery injury. Now every parent knows this one. Your child was running around, playing as usual. Suddenly they injure themselves and they come in screaming with pain. Most of the time there's a bruise involved, usually on the shins, knees, and elbows. You don't know what happened, and neither does your toddler. Bruising injuries happen commonly, but resolve just as quickly. So when should you as a parent worry? The biggest red flags include loss of consciousness, seizures, lethargy or drowsiness, significant burns, deep cuts with active bleeding, persistent severe pain, and breathing difficulties. When in doubt, trust your instinct and seek medical help. This part is important. Most toddler injuries happen despite good parenting, not because of bad parenting. Children fall, children climb, children explore. That is literally who they are. I've met very few parents whose children have never been injured. What matters most is creating a safe environment and knowing when to seek help. If you take one thing away from today's episode, let it be this. A bruised knee often means that your child is exploring their world. A scraped elbow means a child is learning. And a fall off the bed means the child is exploring. Not every injury is an emergency, but knowing the red flags can help you keep less panicked and more prepared. Because if you're raising a toddler, toddler injuries are not a matter of if, they're a matter of when. As a parent of a toddler, here are a few things I would always have in the house. Number 1, paracetamol or a non-sedating painkiller. Number 2, burn shield. Number 3, plenty of plasters and bandages. And number 4, an antibacterial ointment. Thank you for joining me for another episode of Tiny Matters with Dr. K. Until the next time, stay kind and stay curious.